There's peace on that one. They hired somebody. Oh.
Things are just getting started here at CROI 2019. I'm Anne Rancourt for HIV.gov, and I'm joined by my colleague, Dr. Carl Dieffenbach, Director of the Division of AIDS at the National Institute of Allergy and Infectious Diseases. Carl, thanks for being with me.
It's great to be here in Seattle again and to be at another CROI.
And things are just beginning. People are registering here behind us and starting to buzz about what we're going to hear this week at CROI. Carl, what are you most excited to hear about this week?
Well, I'm really excited about some of the plenaries this week. Tonight we have our boss, Dr. Anthony Fauci, discussing the scientific underpinnings of the HHS-wide initiative that will help us draw down the epidemic in the United States. As we all have heard, the plan for that is over the next 5 years, the goal is a 75% reduction in HIV incidence, and then getting us to a 90% reduction over a 10-year period. Additionally, we're going to hear from Michelle Nussenswag from Rockefeller University about his work on broad neutralizing monoclonals, which is a very exciting field in HIV for both treatment, prevention, and cure. There's going to be a lot this week at the conference about monoclonal antibodies. Tomorrow's plenaries are particularly interesting. We're going to first hear from Jeannie Marazzo, who's going to talk about the importance of STIs in the battle against HIV and how they remain a significant co-infection that helps promote HIV acquisition. So this is an important talk. And then we're going to hear from Irene Soretti from the NIH, who's going to talk about inflammation. And the title of her talk is fantastic, Fanning the Flames. And if you think about what inflammation does in HIV disease, it really does fan the flames. Now say that 10 times fast. That helps to really maintain a level of inflammation in the body where HIV likes to grow when in a state of immune activation. So these will be very important talks today and tomorrow here at the conference.
Great, and we'll be covering those on Facebook Live, so I hope that you will continue to tune in this week as we talk about what's going on here. Share your comments, share your questions. We'd love to address those while we're live. And so, Carl, another theme that we're seeing emerge at the conference related to the new plan to end the HIV epidemic, and also something that affects communities globally, is the need to test, treat, and link to care. We see that the need for that in major U.S. cities. We see the need for it in African communities. Tell us more about why research to optimize this process is so important.
So this is a fundamental problem, as we've always thought about this as discrete steps. Testing is a discrete step, linkage to care is a discrete step, engagement in care and starting antiretroviral therapy as discrete steps. And if each one of those is associated with a delay, what we know is that for each week or two delay between each of those steps, people fall out of what we call the care continuum. What we fundamentally need to do is find ways of turning this on its head. And so everything is integrated into a single step. Testing and understanding the diagnosis of an individual would be the beginning of an appointment, followed by linkage to care and starting therapy all within that first visit. San Francisco General pioneered this with a program called RAPID, and that has rolled out around the country. So I think it fundamentally is we need to continue to innovate in that space so that we do not lose people that we have successfully identified as living with HIV, so we can help them get into care and on treatment as quickly as possible. The other point about the RAPID program is the sustained staying with your treatment is much better in people that start on the RAPID program. So there's a lot to go for it in those situations. But fundamentally, what you need is a healthcare system that is designed specifically to help the individual, not have these discrete individual pods that where there's essentially a problem of linkage between each of those categories.
And innovation is definitely the name of the game of
It has
what
to
we'll be hearing this
Yes.
week at CROI. And while we can't talk about findings that aren't made public yet, you'll have to tune in for that throughout the week. Tell us a little bit about some things we might see related to testing. And there are two kinds of testing that people might think about. There's testing to see if you're HIV positive, and then there's testing when you know you're living with HIV to find out what your viral load is.
So, one of the important changes that we are seeing occur is the adoption of the U equals U message. If you are if you follow your doctor's orders, take your medication as prescribed for 6 months or more and become fully virally suppressed, meaning you have, when they test your viral load, there's no virus present, you cannot transmit the virus to a sexual partner. So if you think about that, a key part of that is being able to perform the viral load tests, whether it's in a healthcare setting, or ideally we'd get to a point where we had a point of care or in-home testing for that kind of viral load measurements. Globally, the challenge is not every jurisdiction has the ability to do viral load testing. So this puts pressure on the international community to make it so that U equals U can become, the third U would be universal. U equals U for all, as in U. But that will require significant improvement in access to viral load testing. At the same time, as we think about research and the ability or the need to be able to provide people real-time diagnosis of a viral load, we're going to need point of care and home testing in a way that is still a research goal at this point.
And another concept that we hear a lot about is the need to make sure that tools work for people's lives, to make sure that people desire to use those tools, both on the treatment side and for HIV prevention. Can you tell us a little bit about where we are in the research process, and if we'll hear anything this week about that?
I think the interesting thing is one of the areas that is a little bit of surprise is how approachable the community has been about injectables and implantables. Fundamentally, if you think about the ease of taking a pill a day, you think that's easy. And then we have a study like the AMP study, antibody-mediated protection, which requires infusions of antibodies once every 8 weeks. One would have thought that the community would have tired of participating in a study where infusions were the coin of the realm and the delivery method. The degree of follow-up in the AMP has been phenomenal. The community has embraced it, and it really shows that what you have to do is have a conversation with people. You have to have a forum where there's safe space for discussion, so you can truly understand how these different modalities would fit into people's lives. And a pill a day has its own stigma associated with it. There's a daily reminder that you are in fact living with HIV. Is there a way to use therapy that is long-acting that relieves people of that? And say that you only need an injection or an implant every 3 to 6 months. Those are the kinds of questions that the behavioral and social science community will need to unpack with us as we understand how to use our new tools in the future.
That's great. And you mentioned the complicated lives that people lead, and we'll be hearing from Dr. Morazzo later about sexually transmitted infections. We'll also be hearing at the conference about drug use and how that can complicate the lives of those living with HIV or at risk for HIV. As we learn about these other factors, what does that tell us for the healthcare system and how we implement care?
Let's go back to 2000. The Durban International AIDS meeting. There were many people, the naysayers, that said, you can never deliver antiretroviral therapy in the low and middle income countries. Fast forward 19 years and we have almost 20 million people on therapy globally. We can deliver therapy. There's people say that people who inject drugs are not capable of adhering. That's been debunked. Never underestimate the durability of the human spirit. If you can get to somebody and have the conversation with them that this is for your health, and if you have their trust, even somebody who is an active heroin user can adhere, and often does adhere, to taking their pills. So I think we have to shed our own biases about people and stop judging, but have the conversation about them as individuals, and then figure out how using behavioral and social science to bring us together better as communities so that everybody has access to care and access to treatment. Ultimately, the one great thing about being in HIV research is that we view healthcare as an inherent right. This is not something for just the West or the North, but it is something we see as a global commitment that we are making.
Wonderful. And yesterday, Carl, you spoke at a seminar on HIV Cure that was organized and attended by HIV advocates and also folks from the local Seattle community here. Tell us a little bit about what people there are looking for in terms of an HIV cure and news on an HIV cure, and if we'll hear anything about that here at CROI.
So we will hear about, the event yesterday was a very important event because it represented the 12th anniversary of the one bona fide cure we have in an individual named Timothy Ray Brown. Timothy was in attendance. I had started speaking and suddenly Timothy walks in and all I wanted to do was grab him and hug him. Instead, I shook his hand and he sat down, and it was just great to have him as the reminder. But there's a lesson here, is that he's the one. And he's the only one over the last 12 years. Hospitals and clinics around the world have been trying to repeat that experiment, where you have individuals with HIV and cancer, and in virtually every other case, the people have died of their cancers. Apparently at this meeting there's a presentation about another case that seems to be a couple of months out. Whether or not that is another true Timothy Ray Brown will be revealed over time. So we'll have to wait and see. But I think what the community is looking for is honesty. Don't sugarcoat it. Tell us the truth. Where are we in the process of getting us toward a cure or a sustained virologic remission? So the way I closed my presentation yesterday was we're at the end of the beginning. We have some interesting leads. Are any of them going to truly work? We don't know. But together, working with community scientists, community, interested individuals who can participate, we can do this, but it'll take time. There will be failures along the way. I acknowledged that yesterday, but ultimately we'll get to our goal of sustained virologic remission in the absence of therapy. Importantly, we will not know how long that sustained remission will be. So we have to have the tools where people can test themselves at home so that they are rebounding, they can get to a clinic. So this is the honesty and openness we have to have, as well as the better tools moving forward.
And Carl, we're joined here at CROI with about 4,000 other folks who have come together to talk about the latest science in HIV. Why is it important to have these gatherings? What's the purpose of CROI?
The purpose of CROI, this is a very important question because people don't understand unless you are in the science. You have, in this room today are people sitting around on their laptops getting ready for the conference. From where I'm standing, I'm looking at all the empty poster boards, which by 2 o'clock tonight are going to be full of information being presented for the first time. So essentially what we have is massive information overload here at a meeting like this. You find your cohort of people that you're working with, or information that's new and interesting. You talk to people. Out of that comes new ideas for you, but new ideas for those individuals. New collaborations form. And there's a synergy that always is budding of new ideas and new strategies comes out of a meeting like this. So it is about getting together, talking about the latest successes, and equally important are the latest failures. If something doesn't work, it's so hard to get that published in the literature, but this is where Here is where you hear about the things that didn't work. So those alleys are closed off. You don't need to go down them again, and you can then proceed in a much more efficient way, but collaboratively with people that you've had a chance to talk to here at the meeting.
Wonderful. And so we will be back throughout the week providing updates on the science as it becomes available. So I really hope that you will join us. I'll be back tonight with Dr. Anthony Fauci talking about the new initiative to end the HIV epidemic here in the United States. Carl, thanks for joining me.
It's a pleasure. See you later this week.
We'll see you soon. And for more information, visit hiv.gov. Thank you.